The talk on this episode is about a very important topic. This is eye care during this COVID era. We've been battling COVID for over a year now. It looks like we'll be continuing to battle it for at least 6 months, if not a year. And we are going to have these issues that are going to last us quite some time more. Brings out a question to the forefront. How do we look after our eyes? Who needs to see an eye doctor? Definitely. How do we go about it, making it safe for the patient as well as for the hospital? Now, unfortunately, a lot of the eye disorders are silent and they do not cause any symptoms. But they can be devastating and cause permanent loss of vision. A simple one would be glaucoma. Several patients suffer from glaucoma, which is most often a silent disease with no pain, which needs frequent follow-up, checking eye pressure, looking at the structure or the function of the nerve, and ascertaining whether the glaucoma is under control or modifying the treatment appropriately. A person who has got glaucoma, known glaucoma, needs to see an eye doctor at least once in 6 months or at least once in a year, definitely. So make sure that if you have glaucoma, please do get in touch with your eye doctor, get yourself examined. Second, every diabetic runs a risk of developing diabetic retinopathy. We advise all diabetics to get tested every year. If there is diabetic retinopathy, get treated and please test every 3 months, every 6 months. This brings out the second issue. With all these ongoing problems, how do we go to the doctor? How do we make it safe? How do we follow up? Just because there are no symptoms and you're not noticing any problems, staying back at home can worsen the condition to a point where recovery of vision later may not be possible. Even children wearing glasses, every year, the growing age, the power can change. So they also need to see the doctor so that they don't lose out on vision. So that way we can go on with even cataract. As cataract gets more advanced, it becomes more difficult to treat, both for the surgeon and the patient, and outcomes also may not be as perfect as treating at the optimum time than treating it very late. So all put together, one has to now get into stride and look at your eye health in spite of the fact that we have COVID going on. How do we look at the safety? The doctors and the hospitals are following strict norms of social distancing, continuous fumigation and disinfection of the premises, and they are reducing the number of patients that they see. So please make an appointment. Make sure that you're going to be safe in that particular hospital. Visit the hospital, get yourself tested. How you can help the hospital? Please go with a minimum number of people. There is no point if there's one person who needs to be examined, 3 or 4 people going along with them as attenders. Even if it's 3 people in the family who need to be tested, just the 3 can go there or they can go with 1 attender. Bring down the attender down to the barest minimum, bring it down to 1. Please wear masks wherever you are, particularly in the hospital. Follow social distancing, the hospital will help you with that. Follow hand washing or hand disinfection. Get the treatment done quickly, examination done. All hospitals now are fast tracking all the treatments or the examination and the diagnosis. So use that as much as possible. So do not shy away from getting to an eye doctor, because a lot of times in like cataract, diabetes and glaucoma, or even a person wearing glasses, it can make a difference to permanent loss of vision. So follow the norms, find out the norms that the doctor or the hospital is following, maybe call up, make the appointment, be there on time, and help the doctors serve you in a safe way, and also get the safety incorporated into your visual requirements.